David, if I'm not mistaken, that armored guest back there, is that an artifact of a great, great grand relative that fought in the Roman or Spartan wars?
John, both of you and I had to work on our backgrounds for this podcast. You were like in a cellar or a dungeon or something, and
Yeah,
you at least got
yeah.
some. Yeah, but that's
No,
the
now
Spartan.
I'm in the children's room.
That's the Spartan man. He's going to be our primary guest today, along with our other guests. Let's get this show on the road.
Let's do it.
Welcome aboard Lifelines with David and John, your guide to charting the transformative course of crisis intervention and the game-changing 988 Lifeline.
So welcome back to Lifelines, the 988 podcast, where each call brings a new beginning. We're coming from the heart and soul of Atlanta, Georgia, and stretching out across the nation, diving deep every week into the pulse of crisis intervention, exploring the rich history and the promising future of 988. We're your hosts. If crisis is your jam, then Dr. John Draper is your guy. I was thinking, John, if Richard McKeon is the grandfather of 988, does that make you the mother, the cousin?
I think the weak sister, perhaps.
I'm David Covington, and we were Crisis way back before Crisis was cool. Watch us on YouTube, like and subscribe, or wherever you listen to your podcast and get your daily dose. We're brought to you by Behavioral Health Link, and episode 9 today is really exciting. Brooklyn, tell us a little bit about our amazing guests and what we're going to be doing today.
Dr. Jonathan Singer is an amazing man who's done incredible work as a professor of Loyola, is one of the top podcasters, maybe the top podcaster in social work history, also a suicide prevention specialist who's at one time was the president of the American Association of Suicidology and continues to do incredible work with schools and suicide prevention. I couldn't be more happier than to have someone like Jonathan Singer here with us today.
Yeah, me too, John. I had the great opportunity to work with Jonathan on the board. And Jonathan, tell us, John Draper, tell us a little bit about our sponsor, Behavioral Health Link, who's bringing us the podcast.
David, our guest, Dr. Jonathan Singer, he's all about establishing meaningful connections in crisis care. So just imagine a world where every person in behavioral health crisis finds immediate connection with people and services at a time when they need it the most on their worst damn day. And technologies that keep them and the providers serving them connected throughout their crisis care journey. And this is what the BHL platform is all about. A groundbreaking software solution that connects individuals in crisis to the care they need when they need it. Whether it's our innovative call center module, our outpatient scheduling or referral modules, or our GPS-enabled mobile crisis dispatch module, or whether it's our follow-up module that helps us stay connected with them and supporting them, or our technology that helps us connect them with an empty crisis care bed in real time. The BHL platform is here to help them stay connected with the people they and you care about in real time and over time until the worst days that they have are well behind them. If you want to learn more about how the BHL platform can connect your system with your people, visit behavioralhealthlink.com. David?
Thank you so much, John. And Jonathan, I was on your podcast, has to be 8 or 10 years ago now. We've laid out a little bit about you. Tell us something that maybe John and I wouldn't know about you.
Well, let's see. In the early 80s, I was a break dancer.
A break dancer.
Yeah, I was the only white kid on I went to school in the DC area. My junior high was the only white kid on the breakdancing troupe. And they gave me the nickname Poppin' Fresh White Boy. As an
fresh white boy.
Yeah.
Is there enough room in that facility where you are to just show us a little bit of that breakdance?
I mean, you can do a little bit of this, you can do a little bit of that. I don't know how much you guys can see here.
I see all of that. Yeah, that's great.
And locking. So yeah. So there was that, but one of the things that I loved most about breakdancing was the music, because I'm a drummer, and so.
Okay, so hold on to that, Jonathan, because I don't want to give John Draper any clues. He cheats. He goes on Facebook for this next part. But the other thing we do is we look at what you're a super fan of. The breakdancing, you're not a super fan of that, might get maybe. But like I'm a super fan of Spartan races. I do the obstacle courses. Those are the medals from my races. John, you're a super fan of what?
Well, I too love music like you do, Jonathan. So, and very eclectic. So
I've got a blank piece of paper here. I'm just going to write on here what I think Jonathan Singer is a super fan of. I've known Jonathan for many years now. Jonathan is a super fan. Let's see. Jonathan, where are you located?
Well, right now I live right outside of Chicago in Evanston, Illinois.
All right, so it could be Chicago Bulls. There's so many things this could be, John. So, John, right quick. Okay, I've got mine. John, do you have yours?
Yeah, I got it.
All right, so on the count of three, we're going to lift I think Jonathan is a super fan of.
Oh, wait a minute. Yeah, wait a minute. What is that?
It says playing in a band.
That right now, David. You just did that right now.
Jazz dads.
Jazz.
Oh my God.
Yeah, but wait a minute, David. You just did that right now?
Jonathan, are we right, or is there something else that you would like to call out that you're a super fan of?
No, you are totally right. Jazz, I'm a huge fan. You're 100% right. And the Jazz Dads is the group that I've been playing with for the last year and a half. Out here in Evanston.
Post-COVID thing.
That's right. That's right.
We could probably use some of that music for our opening intro, David. I would love to hear some of that jazz intro that he's doing. That would be cool.
I agree. So let's go to our trivia question to start the show. And I'm going to bring up the over-under, John Draper. John, you've been doing well on the over-under up against our guests. Jonathan Singer, it's an easy trivia. I'm going to ask a question. John's going to pick a number, or it's usually a number, because you've got to decide, is he high or low? Is the truth over or under? So Preston Looper and Matthew Goldman were at the National Council for Behavioral Health, gave a great presentation on mobile crisis services. And one of the things they asked about, John, in the survey that they did recently was, is the mobile crisis 24/7? Is the mobile crisis going out in a two-person team? But the question in today's trivia over-under is, what percentage of the time is mobile crisis connected to and dispatched from the 988 call line? So you're going to pick the percentage, John Draper, and Jonathan Singer. You're going to say it's over that or it's under that. What percentage of the time, John, is 988?
Yeah. I know it's
giving out mobile.
I know it's not great. I'd say it's about 35% of the time is what I would.
Wow. Okay, 35. Just about 1 in 3. Jonathan, is it over or under that? You call 988, and they themselves can dispatch as opposed to going through a third party.
I would say it's under.
So, John Draper, such a good man. John has been cutting these tight the last few weeks and making it really hard for our guests. But in this case, Jonathan Singer, it's just slightly under. You'll see that serves all people regardless of insurance, 90%. Two-person teams, 60% of the time. Coordination with crisis facilities, 24/7 operations with greater than 11 FTEs, 40% of the time, but actually the lowest percentage, 32, for that integration with the Lifeline. So, John, you saw that it was going to be low, but it's such an opportunity as we move forward. What are your thoughts?
Jonathan's more of a cynic than I am. So it's like, no. You think that's bad? I can make it worse. Yeah.
Yeah. I used to do mobile crisis response, so.
Well,
yeah,
okay. So all three of us are former mobile staff.
Yeah.
Ron, you got your start in crisis care and mobile, and I was carrying a pager back going to EDs in the middle of the night back 25 years ago.
Yeah, I saw that, Jonathan. I did it for 7 years. That was my start in crisis care. And I was fast. Not only did you do it, but you did it in Austin, Texas. And I'm thinking that what you were doing in Austin, Texas, which wasn't just mobile crisis work, it was also family work in homes. Yeah. And because that I think is the future. Tell us a little bit about how that experience was.
Yeah. Well, it was an amazing experience. And I have to say, like, having had that experience, I just kind of assumed everywhere had that. Yeah. And it was quite the education for me to realize that was not the case. So we would get called out. We would do the mobile crisis response. And we had these two systems. We had the crisis stabilization, which was kind of like a 30-day system where, we could interact with folks as many times in a week as we went. It was sort of grant funding, it's block funding. It wasn't per service. And so I would see kids and their families 3, 4, 5 times a week if necessary. And then we would refer to what was called family preservation program, but it wasn't sort of the child welfare family preservation. It was really home-based family therapy, where we would do 2 to 3 times a week in-home, in-school, intensive family therapy. And we coordinated really closely with the crisis services, because obviously a lot of the kids that we were seeing in the homes would go back into crisis on a regular basis.
Did you see some impact? I'm sorry, David, I just wanted to ask, what kind of impact did you see as a result of those home-based services? Because I think that is the future of mental health treatment for kids in homes.
I mean, we were able to get so much done so quickly. Like, there's nothing like walking into a mobile home and seeing where people live, how they're living, what the dynamics are, to understand something that you can't get from like a year of somebody showing up to your office, understanding where the school is in relationship to them, seeing the sheriff's deputies driving up and down the street, or not having a grocery store anywhere near, like just so many things, right? So you understand. And so what we were able to do is we were able to establish these relationships with families and spend part of the time that we were working with them in kind of what we might think of as a traditional therapy, like addressing the family dynamics, et cetera. But part of the time that we spent over the 3 months was really shoring up those services, so that when we were out, that there was connections through faith communities, there was connections through sports and hobbies, the schools, all of those sorts of things, because that's what we were there to do. So,
yeah. So you started out in hardcore social work, Jonathan, on the streets.
That's right.
How long did you do that, and what was the pivot into academic sector?
So I did that about 6 years, and then maybe 6.5. And then so after 9/11, my former classmate at UT Austin and then coworker Nate Havlick and I, we realized that we had not taken a crisis class in our graduate program. And we're like, that's ridiculous. Literally the only kind of client that anybody is sure to see is somebody in crisis. So we wrote a crisis syllabus for the MSW program at UT Austin. We submitted it. They looked at it. They were like, this is terrible. But to their credit, they handed it off to somebody who said, I will work with you to make this a class. Right. I mean, we had 13 assignments, 3 textbooks. Like we were basically like, you will live and breathe this class. And they were like, no, they won't. And so then it got to the point where they invited me to teach the class, and I was reviewing the data. I was reviewing the information, and I thought, there's no empirically supported interventions for families with suicidal kids. That's so weird. And I was talking to the dean. I said, can you believe that? And this is in 2002, 2003. And she said, well, Jonathan, really hard to do research with families, right? How do you evaluate change in a family? It's really hard to do research with kids, right? Protected class. And for folks that are suicidal. So you got 3 things going against you. And I said, well, I hope somebody gets around to it. And she said, isn't this what you do? Like, don't you do family therapy with suicidal kids? I was like, yeah. She's like, so it should be you. And so that's what inspired me to go back for my PhD. I went to University of Pittsburgh, met David Brent, all those folks, then went to Philly, hung out with Guy Diamond, attachment-based family therapy. And so that's that.
Yeah, great. So let's move into a good news segment. We every week, Jonathan, look at what's going on. And John Draper, one of the things that's going on is after a 5-year time frame, we are going back to a global leadership exchange. This is an actual picture from the future, Jonathan. It's a picture in Amsterdam of a group of people coming out of day one of the Crisis Now Summit, John. And they are running to the immersions of going to tour various sites.
Yeah, I was wondering if it looks more like they're running in terror, David. I mean,
I'm pretty sure this is excitement about day one. But John, we actually have not been together in these global events since 2018. We were planning that in 2020. We had a Zero Suicide Summit in Rotterdam. In 2018, we did a crisis summit in Washington, D.C. in 2019. And then everything got put on hold, waiting for the Global Leadership Exchange, what Jonathan was previously called the International Initiative for Mental Health Leadership. But they are coming back together in actually Utrecht, outside of Amsterdam. John will be in Liverpool for a Zero Suicide Summit, but on Saturday and Sunday, we'll be in Amsterdam at the Deloitte headquarters, the Edge. And it's apropos, John, given the work of Jan Mockenstorm back 5 years ago when you and I were there.
Yeah, I think this is going to be radically different. And to the point that Jonathan was making and what we were just discussing in terms of crisis care and innovations in crisis care, a lot of what happened at the Zero Suicide Summit in the past, a lot of it that was still trying to stoke the interest in just the notion of zero suicide, but just about all of the nations participating have really, really active programs and crisis services, but we don't know what they are. And so I'm really curious to see what kind of innovations they have there that we can bring back home. Again, I'm thinking home-based family therapy is a thing that we really we can use to keep kids out of residential treatment. But what more can we learn from people overseas, David?
Yeah, Jonathan, it's not too late for you to join us. I mean, even as you were talking about the social work you did out of the gate, there is a leader from the Netherlands named Elnathan Prince, I believe, or it's along those lines. He actually came on to our Crisis Jam learning community a couple of years ago, John Draper, about the out of basically home-based inpatient care that they're doing with adolescents, Jonathan. So, how close are we to that kind of service and support in the United States? We need a 988 that can dispatch a mobile crisis team, but those challenges for youth are significant. Jonathan, as we get into our next segment here, you have been doing a podcast long before podcasts were the cool thing to be doing. The Emotional Lives of Teenagers with Lisa D'Amour was one of your most popular episodes. Tell us a little bit about your work in that space of podcasts, and in particular focusing on adolescents.
Yeah, so I started the podcast in 2007 when I was a doctoral student at the University of Pittsburgh, in part because I wanted folks to be able to learn on the go. I also wanted it to be a place where you could archive information that people could have ready access to. On the podcast, because it's a one-person shop, like it's just me, I get to pick who I interview, I get to pick what we talk about. And because my focus has always been on youth and families, we've had a lot of episodes around youth and families. And being able to get to know Lisa has been fabulous. I think she is one of the best translators of science into practice that is out there, regardless of discipline. I also love the way that she conveys information when she speaks. And so, having a guest on like Lisa is really about having social workers or other mental health professionals be able to listen to something maybe in between home visits, maybe when they're driving to work, maybe when they're in class and, professor wants to bring something in that can inspire them to think, because you're not teaching to the test. with this conversation. You are providing some insight, you're providing some perspective. And at the end of the day, any professional needs to be able to think critically in the moment about what the person that's on the other end of the phone, what's across the room from them, what's on the Zoom, what they're saying, and then be able to bring in all of the other information that they have. And so an interview like Lisa is perfect for that, because she's not walking you through a therapy session. She's not talking you through a research study. She's saying, hey, so this is the experience for parents when their adolescents are like, I think I need to individuate, right? She talks about as kicking off the side of the pool, right? And it's this amazing way of bringing in the information. So I just feel very grateful to have had the opportunity to talk with folks like her.
Yeah, and I think that was a two-parter, as I recall, right? And it's there's so much information in those podcasts, and you said she does such a great job conveying information. It sounds like you learned a few things, even being the expert that you are, Jonathan. I'm wondering if there was a nugget you took away from that you've been sharing since, that you got to hear what Lisa said. Anything that you can share around that?
One of the things in her most recent book that I thought was such a great insight was, and this is not a direct quote, but it's basically like mental health is not about feeling good. It's about having the right feelings for the right time and then knowing what to do with that. And it really pushes back against, what we talked about in the episode is kind of the wellness industrial complex, like this idea that people, not just kids, but people have to feel good all the time. If you're not feeling good, something's wrong. And it's like, no, like, I think about, some of the research from the crisis line that came out over the pandemic, which is that people were saying, I'm anxious, I'm feeling sad, and also they weren't necessarily more suicidal, right? And it's like, it's an anxious and sad time, right? These are the right feelings for the moment. And what they're doing is they're reaching out and they're doing something with that. Yeah. Sorry, David.
Yeah. So Jonathan, I don't want to hear that. So you talked about the pushing off the edge of the pool. Yeah. John is further along than I with Delilah pushing off the edge of that pool, but I see the pushing off that edge of the pool. I've got a freshman and a sophomore in high school. So you're telling me how do we deal with that? And John, how is your anxiety and feeling of that? She's swimming out there, John.
She is, but I want to hear what Jonathan says first, and I'll come back to that.
Well, so I think that the swimming pool metaphor was so great for me. And this is something that Lisa shared on the first episode that I interviewed her for, which is her book, Untangled. And the analogy is that when you're with kids and they're little, you're by the side of the pool. As they get older, they swim further out, right? They're hanging out. And when you have teenagers, right, they're hanging out in the deep end. And sometimes they get bored because there's nobody else to play with. They get hungry, or they're out there and they're tired. So they swim back to the edge of the pool where you are, right? Sort of a good enough parent. You're sitting there. Not good parenting is swimming out to the deep end to be like, hey, are you hungry? Are you bored? Or can I do right? You're waiting for them. So they come back to you, you entertain them, you feed them, you comfort them, right? Maybe kids have been splashing water in their face. And then when they've gotten their needs met, what do? They kick off and they go back to the deep end. And sometimes it can literally feel like they're kicking you, right? You're like, oh, that thing that they loved when you were little, they turn around, they're like, oh my God, Dad, really? Like, you're supposed to be a professional? I can't believe you just said that, right? I mean, not that your kids would have ever said that to you, right? I mean, so...
Hell no.
But so there is that pain. And then and I think one of the most powerful things that Lisa said was that one of the things that parents do wrong is when kids come back because they have a need, the parents think, they're back for good. And then they're surprised when they leave again.
Right.
And it's the leaving, and we know this from attachment theory, right? If you've done your job, like they go, they explore, they've got a secure base, right? It's fine. It doesn't mean it doesn't hurt, right? And so I also have a sophomore rising junior in high school. And so I have certainly felt that.
Yeah, Jonathan, I wrote my dissertation on the second stage of separation individuation on leaving home. That was, and I studied that actually for 4 years. And so I felt pretty prepared, I thought, when Delilah launched. But it's a lot more complicated when it's your kid. And also, when her mother's also involved and her mother's like, don't leave. So yeah, it's been a real task, but I'm curious about that entire educational process of teaching parents and kids about their mental health. That's not something that's done in schools, yet we know the second leading cause of death among young people is not knowing how to deal with life. So do you have an opinion about how schools can and should be involved in teaching parents and kids about mental health?
So I love how you phrase that, parents and kids, because I think one of the problems is that a lot of programs focus exclusively on the kids. Now, I understand it's the kids that are in the school, right? They're the captive audience. The schools have the mission, the responsibility to teach the kids. But when it comes to mental health, and particularly when it comes to suicide risk, right, this has to be a family situation, either in the situation where things are going on at home with the family that might be exacerbating some of these issues, or that family becomes that safe space, right? And so school is one of the dangerous places. The article that I co-wrote with Sherry Moloch and folks in 2023 about culturally responsive assessment for youth of color, right? One of the points, and I didn't write this part, but I loved it, really had to do with this idea that, a home for particularly youth of color for whom predominantly white spaces are a high anxiety, places of aggression, micro or macro, that the home becomes the safe space. And when there is rupture in those home spaces, it can actually be even more devastating for those kids than for a kid, maybe a white kid or a kid in the majority somehow with their identity, who has lots of support outside of the home. And so what I think, getting back to your question, is that I think that when schools are thinking about social emotional learning, whatever you want to call it, that thinking about how do we incorporate the parents into this, both in terms of like, this is how we're addressing this in the schools, but also, and this is what we want you to know, and what we want you to do. Those are all really important pieces. Could be, sessions with the parents, kind of like they do in multifamily groups, whatever it ends up being. I think that is a key piece in addressing this issue of I'm having the right feelings for the right time and I know what to do with them.
Great, Jonathan. So this idea of overall this metaphor of the pool, and then this concept of feeling the right feelings, that the Inside Out 2 is coming out soon. And that movie did such a great job of laying into that concept. But Jonathan, let's switch gears a little bit. And of course, you've written a best-selling text about suicide in schools. And I love this discussion of youth, John. But Jonathan, you also, one of your other top podcasts was with Stacy Friedenthal, living with someone with suicidal thoughts. And John has certainly been a pioneer in the space you have of getting to know and be transformed by, as well as lift up the voices of people with lived experience. Talk a little bit about that podcast, Jonathan.
I mean, well, first of all, Stacy Friedenthal is amazing. And I first met Stacy back when we were in Austin. She was actually working on the dispatch line.
Really?
Yeah. What? Yeah. And she ended up going back for
dispatching mobile crisis.
She was calling. She was answering the lines, right? I mean,
that's one.
So
yeah.
So the I think one of the insights that Stacy has is both as a professional, right? So how professionals can talk, but also she has her own lived experience, and she has been a person with lived experience. She's been a parent of somebody who's struggled. Obviously, she's got friends, and so what she's done and what she talked about on the episode was really, how do you think about some of these concepts, including some of the things that are a little sticky for us, right? Like the idea of are they manipulating me, right? And one of the things that she says, and I love this, she said, you might feel like you're being manipulated. It doesn't mean they're manipulating you, right? And again, that distinction is one of those really subtle but profound insights that talking with somebody with lived experience or talking about sort of the learnings of lived experience, I think is so powerful. Because it moves us away from that history or the historical place of people saying, well, this patient is resistant. They are manipulating. They're making my job as a professional harder, and that's on them. And Stacy and so many others are like, no, this is not about you. This is not about you.
So, Jonathan, such great content in this podcast you'll have been doing for 20 years coming up here in a minute. So let's talk a little bit, our next segment, a little bit of rapid fire, Jonathan, about I'm a regular or no never. I'm a regular or no never. I'm going to go through some podcasts, Jonathan.
Okay.
So the first podcast, I'm a regular or no never, Unlocking Us with Brene Brown.
I've never listened to it.
You know the Brene Brown work, though, and
I do. She's also a social worker.
She is. Now that I don't think I knew that. Yeah,
she's a social worker, and she's on faculty. She actually has the Brene Brown Endowed Chair at the University of Houston's Graduate School of Social Work. Somebody else that I interviewed on the podcast, Holly Oxhandler, who does stuff on religion and spirituality. Holly was her dissertation chair, and then somebody that I worked with on the publications committee for CSWE, Susan Robbins. Susan was Brene's dissertation chair.
I think your podcast and hers need to have an arm wrestling match, Jonathan.
All right. Second podcast, Jonathan, I'm a regular or no never. The Joe Rogan Experience.
I listened to Joe once, and I was not interested in listening again.
But you've never listened to Brene, but you've listened to Joe.
That's right.
Okay. That's now on video, Jonathan.
He's irregular, though, David.
Hey, Joe Rogan's got a popular podcast. The next one, number 3, I'm a regular or no never. The Social Work Tutor Podcast.
Oh, I've seen that. I've never listened to it.
So, and just as an aside, Jonathan, how many big social work podcasts are out there? Is this a dozen or?
So between 2007 and 2017, there were 4. And then between 2017 and 2019, there were 10 more. And then after 2019, there were like 30, 40, 50, 60. They're more than I can count at this point that either have the word social work in it and or are hosted by social workers.
Okay, how about the Happiness Lab with Dr. Lori Santos? This is the folks. Is it Harvard or Yale, Jonathan, that does the Happiness Project?
I think it's Harvard, isn't it? Or
I think it is Harvard. Yeah, now that you say it. Have you listened to that one?
I did listen to that one. Yeah.
And?
No, but I'm not a regular.
Okay. Conan O'Brien Needs a Friend.
I've seen some of the YouTube clips from that. They're amazing.
I love that.
So, Jonathan, I went into ChatGPT 4.0 and said, what podcasts would Jonathan Singer listen to and not listen to? So you're actually getting a group of those. Office Ladies with Jenna Fisher and Angela Kinsey.
Again, I've seen some clips on YouTube, but I haven't listened to the podcast.
TED Talks Daily.
I've listened to some of those. Yeah.
And we don't have to get into it too deep, but John, I've got to hear the story. You said that, I don't know what it was, but you said Bart Andrews gave a TED Talk that roiled the crowd at AAS. Were you there, Jonathan?
No, he wasn't at AAS.
I wasn't at AAS this year.
Oh, okay. Have you been to AAS since 2019?
I mean, I was online in so
no,
2020 and 2021,
Yeah.
yes, but
Okay, just a
after it
couple of
collapsed, no. So
a couple of more here. Lifelines with David and John.
yes,
You're regular.
I've done my homework.
New Heights.
New Heights. No, I don't think I even know that one.
That is actually the most popular podcast on the planet right now. That's a hint. John Draper, you know New Heights.
You have a daughter, Jonathan?
I do.
Is she a Taylor Swift fan?
Oh wait, is that the Kelsey brothers?
Yes.
Oh yeah. No. She's obsessed with that. Yes, and she's played me that, and I didn't realize that's what it was called. I thought it was the Kelsey Brothers podcast.
Yeah.
Yes.
That's what people say about this. This is the John and David Brothers podcast.
Yeah. No, that's what everybody says.
Therapist Uncensored.
I don't think so. Therapist Uncensored. Who is that?
That's it. ChatGPT said Jonathan Singer would listen to Therapist Uncensored.
Yeah, I don't know.
Last one, My Favorite Murder.
No, you know what? I do not. I do not listen to the true crimes podcast. I was interviewed for one called Vanished, for a podcast series called Vanished. But I don't listen to them. No, what I actually listen to is
I tend to the investigation in any way, Jonathan.
I'm not at liberty to say anything. No, I end up listening to podcast episodes like Code Switch, or series like Code Switch. I really like Malcolm Gladwell's stuff, right? The kind of the Rick Rubin diving into that, right? All that stuff. That's kind of what that's what I listen to. And I have to say, part of the reason why I haven't listened to the Brené stuff is that I've read Brené's stuff, and I've talked with folks, and it's just not something on my off time that I feel like I need to dive into. Although I'm sure it's good.
Jonathan, look, we don't want you on the program without talking about the innovation you've had in teaching. So the incorporation of technology and multimedia is something you're really known for. Tell us about that.
Well, one of the things was incorporating podcasting into social work education. Early on, I actually got an award from a teaching and learning group back in like 2008, maybe. And it was very simple. It was what I would just call substitution, right? I substituted podcasts for readings and lectures.
Yeah.
Now, one of the things that I've done that has been interesting in some classes, although not classes recently, is I've had students do things like go out and record the sounds that are associated with their internship sites. And again, this is sort of an augmentation of a traditional learning, right? Because they then bring it in, and so you get to hear what it's like for somebody who's working in a migrant shelter, whose internship is at a primary care facility, or who's doing home-based, right? And it just gives a different sense of like what the experience is like, and it helps them to tap into something about their learning that is different. Now, I've got a book coming out called Podcasting and Social Work Education that I'm doing with an Australian podcaster named Mim Fox. And we actually dive into the theory of and the ethics of podcasting, the idea of co-production. What does it mean to have somebody like for this, you guys, right? I didn't know what we were going to talk about in advance. It's not that people didn't reach out to me. It's just I never reached out back and said, here's what I want to talk about, right? So you guys, you came up with the questions. We're doing this thing. When it's done, you will do whatever it is that you want to do with this. It is your podcast, right? And so we talk about the ethics in social work, about what it means to have people whose voices and stories might get exploited or might be fetishized or things like that, right? So again, one of the advances in education is, as we think about technology, how are we identifying the ways in which technology can amplify inequities, and how it can sort of create stories about communities that are either problematic or sort of giving access to resources, and then what is the role of the social worker, or the professional, in ensuring that this is happening. So those conversations are the things that I engage folks in.
Jonathan, this whole discussion about technologies and hearing how David's cheating with his Chat GPT, and we've been talking about the youth mental health crisis, and the youth mental health crisis has been, many people have pointed to the technologies of screen time, in particular, mobile technologies that have prevented them from having, real connections with people. And now we've got Gen Alpha, which is just about to enter into adolescence right now.
Mm-hmm.
And they're going to be
twin boys.
Cellular phones came into being during Gen Z, right around adolescence. Yet here we're talking about AI coming into adolescence. And I'm wondering what you think the harbinger of that is going to bring in terms of mental health challenges for young people, and how we might mitigate some of them.
Wow.
I think the experience that, my boys are 12, and so they're going into 7th grade next year. I think that their experience is that they've grown up with access to information, all information everywhere. Like the three of us know what it was like to have heard a song and then go like a decade without knowing what it was called, hearing it again, like having it in the back of your brain. They have no idea what that's like. So they're used to that, but now they're going to have access to, and they're going to be used to having what we think of as not just access to information, but access to intelligence. So intelligent conversations. They are going to be used to having conversations with devices, to talk through things, and let me just say, I think best case scenario is that you get a situation where they're doing some work and they're like, I'm going to, at the same time as working on my trigonometry homework, I'm going to say, you know what? This is freaking me out. And honestly, if I don't do well on this test, I might as well just kill myself. And then the AI will be like, I'm so sorry that you feel like that, blah, blah, blah. Right. And so it will intelligently be able to switch and transition. And so a lot of the things that are segmented, siloed, are going to be integrated. Again, this is the best case scenario, right?
Yeah.
Integrated. And I don't know what that experience is going to be like, because I haven't experienced it. And even if I do get to the point where I'm living in a world where it's all integrated, I don't know how I will experience that. But I think Gen Alpha and beyond are going to be used to this integrated access to intelligence.
Wow.
You're not as cynical as I thought, Jonathan. That's great.
Well, so I mean, so I have to say, so folks like Jonathan Haidt, who have really sounded the alarm on social media and youth, I think there's some real benefit. But particularly when we're thinking about kids in suicidal crises, I think that they miss the boat on a lot of the value of technology, and there is not enough kind of creative thinking, scenario planning, futuring, right?
Futuring.
That is valuable. Saying kids shouldn't have cell phones until they're 15. I mean, that might work if in theory, but it doesn't work in practice. And so I think that, we have to put that in a box.
Jonathan, we actually we have a weekly learning community called the 988 Crisis Jam, and we'd like to have a debate on social media and youth coming up. Would love for you to take the pro side if you might be interested in that.
Yeah, happy to.
Love it.
Okay, so let's go to our final segment with Jonathan Singer today, and we're going to look at some myths, Jonathan. These are, or they're not. They're truth. And I think maybe we look at the majority to be your arbiter of whether this is accurate or not. And we're going to be talking about social workers, Jonathan.
Mm-hmm.
So I could have had Brene Brown as a social worker. Is that truth or myth? I now know that's the truth. But our first one, Jonathan, social workers are only for child protection.
Definitely false. Only 10 to 30% of child welfare workers have a social work degree.
But what percentage work with youth? Is that the majority?
Well, if you include social workers in community mental health and hospitals and schools, sort of numerically, kids come in more often than adults anyway. So, I mean, I think that there's a bias in that sample anyway. But if you look at most of the therapists that are out there, like if you look at Psychology Today or whatever, you're looking for a therapist, most of them that you're going to find are LCSWs, right, for adults. So, yeah.
So it looked like that was close if you did the numbers on children overall. Second, truth or myth. Social workers have all the answers. They know how to exactly solve every problem, Jonathan.
Yes. Next question.
Social workers are hands down better than LPCs. Now, be very careful. Our staff can pull the plug on your feed there, Jonathan.
I can say yes.
Social workers are hands down better than LPCs.
Yes, you're okay, Jonathan. I know what you're going to say. It's yes. Well, you can't pull the plug, David. Go ahead. Next question.
I actually did I asked ChatGPT to give me 10 reasons why social workers are better than counselors. And I was a little mad when it did that so quickly, Jonathan. That was frustrating. Didn't care for that at all. Truth or myth, Jonathan? Social work is a calling, so we don't need to pay them that much.
You know, I would say it's interesting. A lot of people feel called to social work. And I think because the pay tends to be relatively low, people either have that as kind of a rationale, or they genuinely feel like, I don't know what else I would do. Right. And
this living off hugs and gratitude. I actually, John, I just popped into my brain. I think you were the one time that said, I live on the kindness of others and birdseed or something like that. Was that
exactly
you,
right? Yeah, that's my motto, my T-shirt, everything. Yeah, but yeah, I mean, this is also binary, David. Please, can't we have both? Can't we have a lot of money and a lot of hugs?
Number 5 here. Social workers are calm, collected, and never get stressed. Definitely
false.
They're calm on the outside, but inside like a duck paddling furiously. The 6th one, and again, let's go with, it's a myth or truth, but is it the majority? All social workers are Democrats.
True.
It was true. It's true.
I mean, just in general, yeah. I mean, you can look. There's data that shows this, and actually one of the things that we work pretty hard at as professors is being in the classroom, being very aware of who's in the classroom, and knowing that even if the majority of students might be sort of liberal, progressive, Dem, whatever. Most of the folks that are out there seeking services or that are in need of services aren't necessarily reflective of the ideologies and perspectives as those in the classroom. So really pushing back against that is actually good social work education.
Yeah. So the AI said, social workers, they say this. They say we care deeply, but we don't cry over spilt milk unless it's a really tough day. Last one, Jonathan. Social workers love paperwork. The administrative side is easy peasy for them.
Oh my God. That is so false. It is a nightmare. As with everybody knows that the administrative stuff is a nightmare. So,
Jonathan, wow. Thanks so much. But John Draper, it's time for some absolutely true tales of Behavioral Health Link. This is a weekly segment for us, Jonathan.
Ready for it, David.
Yeah, you're ready for it. So today I'm going to go back. Last week, John, we talked about the influence of my mentor, Greg Graham. Today, I'm going to revisit a story of Lynn Copeland. She was the one of the regional administrators in the city of Atlanta back 22 years ago when I first began working, launching that crisis line in Fulton County. And I was sitting in her office one day, and she had on her desk Post-it notes everywhere and different tasks on them. And it was one of those days where she was feeling it, and she just looked at me and she picked up a handful of Post-it notes and just started tossing them in the air, and they were like coming down like snowflakes. But John, this was the period, early 2000s. Jonathan Singer's starting to think about podcasts, but we're starting to look at the inefficiency of the way we did things, of Post-it notes, of you call and you leave a voicemail, and then they call and leave a voicemail. And John, we began then to start thinking about how do we automate these supports and empower our call takers with the sort of tools that you talked about in that promotion of the software up front. But she was sitting there just tossing these in the air, John.
Really? You all were thinking about it that early and she was tossing those in the air? Maybe I can't handle the truth, David. That doesn't sound true to me.
That is absolutely true, John. In fact, you were there, John. You were sitting there with me and you said, we could do this with an algorithm. That's what you whispered in my ear that day.
Okay. It's all coming back to me now. Yep.
John, I think it's some time after this great discussion with Jonathan. We need some plain truth, Dr. John Draper.
Yeah, and hopefully we can handle the truth, David. I was recently at the American Association of Suicidology conference in Vegas, and I saw Dr. Madeline Gould mention a disturbing data point from her 2019 evaluation of Lifeline callers that were assessed to be at imminent risk of suicide. Now, she said that these counselors did help these high-risk callers to take actions to reduce their own suicidality about 44% of the time. That's great. But she also reported that follow-up contacts for callers was offered only 16% of the time, and in no cases, none, was a formal safety plan done for the caller. Now, I get it. Safety plans take time, and so does follow-up care. But I'll quote Dr. Mike Hogan here, our good buddy. He likes to note that both of those interventions I just mentioned are exponentially more effective in preventing suicides than statins are in reducing heart attacks. Yet 1 out of every 4 Americans over 40 are prescribed statins. Now, if you don't know Dr. Maddie Gould, you should know that she has been doing evaluations on Lifeline centers since 2003, and she's got a lot to do with why we have 988 right now. In August 2019, the chair of the FCC, Ajit Pai, pointed to Dr. Gould's findings showing that the Lifeline reduces suicidality as a reason for the FCC's decision to assign a 3-digit number to Lifeline. Chairman Pai stated in his report to Congress that by increasing access to this life-saving resource, a 3-digit number for the Lifeline is highly likely to lower suicide mortality risk in the United States, and thus that the benefits of this action are quite likely to outweigh any of the costs. SAMHSA also reported to Congress in 2021 that for 988 to be successful, they need to fund crisis lines handsomely because they can resolve crises about 80% of the time, effectively reducing unnecessary use of other community crisis and emergency resources. However, to achieve that 80% crisis resolution rate, crisis counselors are going to need time to spend with a caller, time to establish an empathic connection, explore their concerns, assess for risk, and collaborate with them on care strategies and safety plans. The time it takes to accomplish this doesn't necessarily sound like it's always going to be a short call. Dr. Gould reported another study in 2016, and that finding from the Lifeline centers who were using applied suicide intervention skills training, she found that they did a better job with reducing caller suicidality than the centers that didn't use these trainings. But here's what I want to point out about that, is that she also noted that the suicidal caller's length of call time with assist-trained counselors averaged about 27 minutes. That's 3 minutes longer than the non-assist counselor calls, which averaged about 24 minutes. And she stated this, that for every 1 minute that call was lengthened, the odds that callers were less suicidal was increased by 4%. Thus, the 3-minute longer average call for the assist-trained group would be estimated to yield a 12% increase in the odds that callers would be less suicidal. So here's the point, David. Time is money, and the money is now flowing for 988 call centers in a way that it never has been before. But more money for centers does not mean more time on the phone necessarily. In fact, it likely means just the opposite. States, counties, and SAMHSA have focused on the key indicators of crisis center performance, or KPIs, which are the percentage of calls answered, a center's average speed of answer, as well as the caller abandonment rates. Now, the latter two measures relating to our wish to reduce wait time so callers don't hang up. They also look at average length of call, which for 988 is currently about 13 minutes. Look, all these are undeniably critical measures. And as the late, great co-owner of BHL, Greg Graham, was fond of saying, the call center's number one priority is answer the damn phone. However, these crisis center KPIs and the money attached to them did not loom as large back when Dr. Gould was doing these evaluations, the ones that showed crisis centers were effective in reducing distress and suicidality. And that tension between quality versus quantity in business circles, we know it's timeless. Whether it's getting fewer people to do more work or serving cheap fast food versus expensive high-end cuisine, that this quality versus quantity tension will also rise in 988 call centers because we need both efficient and effective care. The new Lifeline Network agreements with centers emphasize both the need for efficiently responding to calls as well as new standards for monitoring quality, which I roundly applaud. However, what we also need from SAMHSA and the 988 administrator is clear communications about different call time expectations for suicidal callers, and for those different expectations to be communicated to state funders who are less knowledgeable about what the needs of callers and counselors working with higher risk individuals are. Dr. Gould's research suggests that suicidal call lengths should average about twice longer than the average 988 call length of 13 minutes. We should be factoring this extra time into our workforce estimates for counselors because time is money, but time is also suicide prevention, and the money for centers needs to account for all the time required for counselors to help suicidal callers feel safe. Now, David, you, me, and the late Greg Graham, we all know that we certainly got to answer those calls and answer them quickly. So callers in crisis don't have to wait. The KPI of call abandonment rates represent missed opportunities with callers in many ways. However, we also don't want to miss the opportunities during calls, especially for people who are suicidal. And we certainly don't want them to feel abandoned after they speak with a counselor. David, that's a wrap.
John and Jonathan, that's some plain truth and a real lifeline. If someone's struggling in that pool and they swim to us, we don't want to push them back until they're safe. Thanks so much today to our amazing guest and friend, Dr. Jonathan Singer. Join us next week when our guest will be Tanja Miles, a community engagement advisor with the Huntsman Family Foundation. Thanks for letting us pull you in this week. And join us next time when we continue to navigate the currents of crisis and care. Until then, remember, every call, every life, every story matters. Stay connected, stay supportive, and we'll see you on the next Lifelines.